I think we are on. Hi, everyone. Very, very nice to have you guys all on today with us. Another exciting topic about insulin resistance and how we can reverse metabolic syndrome. This is our series for the month of January and getting into February. We've talked about fatty liver, we've talked about nutrition. We are soon going to be talking about cardiovascular disease and endocrine related issues when it comes to insulin resistance. But we couldn't go on and have this conversation without a very important aspect. Nutrition is important, but exercise is extremely important. And every week I bring on an amazing guest. And this week, like no other, we have Dr. Anita Lwanga with us. And she's a physician, but an exercise physiologist. And it's so interesting because she says that when she studied exercise physiology, what she learned back then, she's very young, and I don't know how far back that goes, is what we are actually hearing about today in medicine. So it's like it's not new information, and I can't wait to have Dr. Anita, expand on this a little bit. So I hope you guys have a wonderful session. I'll let Dr. Anita introduce herself and tell us a little bit about what she does in her practice.
Thank you, Dr. Vivian. I really appreciate the opportunity to talk with you, to catch up with you, and also to share my knowledge with your audience. So, as Dr. Vivian said, my name is Dr. Anita. I'm an exercise physiologist initially. So, before I went to medical school, I did my undergraduate degree in exercise and health physiology, which is a branch of kinesiology that focuses on how our body adapts and responds to exercise. And I was just telling Dr. Vivian, at that time, we were learning about how exercise helps our lungs, helps our heart, helps our muscles, and even how we can use nutrition to prevent disease. And I have family members that are physicians. And at that time, this was more than 20 years ago, I'll share that information and they're kind of like, that's a little fringe, like the look they'd give me. But now it's like something that's in vogue in medicine. Our patients don't just want to take medications. They want to know, what can I do to improve my health? So I'm so grateful that I have that additional training and that I can talk to my patients about how we can use exercise to improve their health. And then going back to my medical background, I'm an internist. Internists are doctors that take care of adults. And I did additional training in geriatrics. Geriatric patients are adults that are 65 years and older. So my mandate at this point in my career is to help my patients stay healthy and active and out of the hospital by not only optimizing their medications, but by also helping modify their diet, their sleep, and also their exercise.
Really important, especially when it comes to chronic disease. Extremely important. So I'm sure as an internist, you see a lot of patients with insulin resistance and metabolic syndrome. So this is the spectrum before we actually say your HbA1c is high enough and you have diabetes. And so in natural gut relief, our focus is always prevention, 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 right? How do we prevent this and how do we empower our patients? Okay. So how does exercise play a role in lack of exercise play a role, and then exercise, how does that play a role in insulin resistance?
Okay, so first of all, I'm going to explain what insulin does. So, med school, way back for both of us, insulin is something that your pancreas is one of the organs in your belly, secretes, and it helps your body utilize the food or the sugar that's flowing around in your bloodstream for energy. So, it helps take all that energy to your cells so the cells have energy to do what they need to do. If there's extra left over, your body will eventually store it. When you have insulin resistance, you have the sugar or the energy floating around in your bloodstream. The insulin is being pumped out by your pancreas, but your cells are still not getting the energy. So your cells will send a signal to the body, we need energy, we're starving. So guess what you're going to do? You're going to eat more. And eventually you hit a point where you have enough insulin secreted to use that energy, but you have a lot more energy than you need floating around in the bloodstream. So your body's going to hold on to that extra energy and you are going to potentially gain weight. In addition to that, if you have your body producing too much insulin, it can cause other problems down the stream. And when we see people having abnormal responses to insulin, they have a lot of sugar in their bloodstream, they might have a condition called prediabetes, and eventually this can progress to diabetes. So, just going back to confirm to your question, how does exercise play a role in improving insulin resistance? Whenever we eat food, as I mentioned, we have this extra sugar or energy floating around in our body. The muscles are the main cells. I think about 80% of the energy that we produce is stored in our muscles. And we want that because we need our muscles to walk around and do activities. But 80% of this energy is stored, and it's initially stored as glycogen or sugar. And this is the precursor to fat. We don't want that energy to be stored as fat. We want it to stay in the glycogen state or the glucose state. So when you're walking around doing exercise, your muscles going to use this glucose and not stored as fat. So you want your muscles to use that energy. You don't want it to become fat. So the more physical activity you do, the less likely you are to store the food that you eat as fat.
Excellent, excellent. So that's a huge, the muscle is a huge organ that needs that glucose when you take it in. So more use of it and more work of the muscle cells in terms of forming energy is what you want. And that's where exercise comes in. So what types of exercise? What types of exercise? Is yoga enough? What would you recommend?
I love that you asked that question. And I go back to something one of my professors told me. I think at that time, in the early 2000s, HIIT, and we've come back to HIIT. HIIT was in vogue. And he was telling us, and I'm like, okay, whatever. Like, HIIT saves you time. But he's like,
what is HIIT, Doc? Some people may not know.
Thank you for reminding me to break that down. So HIIT is high interval intensity training. So basically you might do something like sprint for 30 seconds and then rest for 1 minute. Sprint for 30 seconds and rest for 1 minute. But when you're sprinting, you're putting out maximal energy. So you can only do this maximal output with intervals of rest for maybe 10 to 15 minutes, and then you're tuckered out. You can't do this every day. It requires a lot of energy, not only metabolically, but your nervous system has to work very hard. So you need that time to recover. And another reason why people like HIIT is that it saves time. If you are a busy person, most of us are very busy, and you want to work out, you are going to love HIIT. A lot of people are trying to do HIIT sessions 3 or 4 times per week, like 4 10-minute sessions per week. Some people think that's enough. That's great. But it's not that simple. So HIIT, just going back to what I was saying about my professor, these short workouts that were very efficient were in vogue then. And other types of exercises that we can do are something like walking. To burn enough energy, you need to walk for a long period of time. So walking for an hour to an hour and a half, that's another type of exercise that's more like low intensity, but you need a long period of time to burn energy. Other types of exercise are resistance training. Resistance training can be something such as lifting weights, using machines, or calisthenics, using your own body weight. Things like Pilates can almost fall into the range of calisthenics. Yoga may be in the form of calisthenics, or the subcategory of calisthenics. It's not necessarily aerobic in nature. The thing with these different forms of training is that they use almost different forms of energy. For example, if you're doing HIIT, your muscles are going to use that glucose that was already readily there to be used. It's not going to have time to go and pull the fat stores for energy. Okay. If you want to burn fat that you've previously stored, you want to start like a walk and do a long, slow walk. And it's usually around the 40-minute mark that our body will start to slowly shift into fat burning mode. And the maximal fat burning mode is usually from the 60-minute mark to the 90-minute mark. Okay. So if you want to burn extra adipose or extra fat tissue that you have, you want to do that slow workout. And then lifting weights or calisthenics is going to burn the glucose that you have readily available. It's not going to use the fat stores because you're doing maximal exertion for only a short period of time. So these are some examples of the different kinds of exercise.
So it sounds like you want a combination.
Yes. So going back to answer your question specifically, yes, we don't want to focus only on HIIT. We don't only want to focus on resistance training. You want to mix it up. Your body needs a little bit of everything in order to have a well-balanced body. And there's actually studies that show, if we're looking at insulin resistance specifically, the initial studies thought maybe HIIT might be more efficacious at improving insulin resistance, but more recent studies are showing that a mix of a little bit of long, slow cardiovascular activity, resistance training, and occasionally HIIT, mixing it up is the best way to improve insulin resistance and also improve your body composition.
So right now, I'm thinking about myself. Right now, I do walk, but I only walk maybe 2 or 3 times a week. And I try to walk for about 60 minutes, right? 45 to 60 minutes. And then I do resistance training once or twice a week for 1 hour, full body, once or twice a week for 1 hour, full body. And then I Zumba. I just started Zumba. I don't know. Is that considered hit? What do you think about that combination?
So
I don't.
Zumba depending. That's
Is
a great
Zumba
question.
hit?
Zumba depending. Sorry, go
Okay.
ahead.
Is Zumba hit? No, it's not hit.
Depending. How long are you doing the Zumba session for?
1 hour.
Okay, that's more cardiovascular. Like if you're
Okay.
doing HIIT, you can't do a HIIT session for more than 15 minutes. You're gonna be tuckered out. Like HIIT is maximal exertion. Say like you can do resistance training HIIT. Like say if you're lifting something fairly light and you're timing yourself for 30 seconds, you're lifting a heavy weight as fast as you can. Usually it also involves speed. You can't maintain that. So it sounds like you're having almost like you're walking 2 to 3 times a week, and then you're doing the Zumba. So Zumba counts as cardiovascular exercise, but it's like a little bit of mixing and then resistance training. So you're having like 6 exercise sessions per week, which is excellent. I think that's an excellent regimen.
Yeah, 2 to 3. Let's say five on a good week. 5 for sure. Yes.
That is still spectacular. That is still spectacular. I think current guidelines are saying at least most of us as adults should be exercising 4 to 6 days per week, and each session should be about an hour. That's amazing. If you wanted to change it up as well, like you could split the resistance training into 2 sessions, 30-minute sessions, but one like full body 1 hour, I think you're doing very, very well.
So what I have not incorporated is HIIT, which could be beneficial, right?
It could be beneficial. But the thing is, it depends also on your goals as well. The good thing about HIIT is that not only are you getting that aerobic component, it also induces muscle hypertrophy. Like you see these sprinters who tend to have like big muscles, or if you're lifting something fairly heavy at maximal intensity for a short period of time, you will build muscle, and then you have that short session. So maybe if you want to add 1 day per week, you could go online and look up, we'll talk more about some of my favorite resources, but you could go online and add one HIIT session. The thing or caveat I'll add about HIIT, because it's maximal in intensity, if you have old injuries or you haven't been exercising for quite some time, which is not you. In your case, I think you're in great shape. You don't want to start out with HIIT if you're not somebody who's been working out for a while, because you can induce some injuries in the process.
So, Dr. Anita, that's a good point. So, what would you recommend to someone who says, I just left my doctor? They say I have pre-diabetes, insulin resistance, like my insulin is at 20, fasting, and they told me to exercise, but they didn't tell me what to do. And this is someone who is pretty much sedentary on the computer, maybe just walks around Costco to get shopping. Where should they start then? Which of these would you recommend? How much time and which one?
I love that question. I think I'll go back to the basics of trying to make a schedule and try to stick to 4 to 6 days per week. And initially, if you're, not in great shape, maybe start with walking. Start with walking 45 minutes, 4 days per week, and then slowly work your way up to 6 days per week. And then in terms of resistance training, the important thing is doing things with the right technique. So even if you're doing calisthenics at home, something like push-ups, sit-ups, and squats, you can still injure yourself in that process. So you need to make sure you're doing things with the right technique. So a cost-effective way of perhaps doing this is, say, finding a university or fitness center near where you live, finding the personal trainers, and find somebody who's has training in personal training or kinesiology, because any Joe Schmo at the gym can tell you to do X, Y, Z. And if they haven't learned the technique, they'll teach you poor technique. So maybe you can book one session with a personal trainer or kinesiologist and tell them, these are my goals. Can you make a plan for me? And they can give you a plan that you can follow through for the next 6 weeks. And they'll show you modifications that are appropriate for you. For example, doing push-ups on your knees or doing wall push-ups. And for also doing squats, they'll make sure you're doing the squats properly. I'll give you an example. When you do a squat, you should make sure that your knees are behind your toes. But to do that, you have to push your center of gravity backwards. Most people, if you're not conscious of it, will do a squat and your knees will go in front of your toes. That can induce injuries to your knees. So just having somebody go through with you with a plan that is appropriate for you at your level, and then they say, here's a 6-week plan. Go and do that and come back. I think investing in yourself and getting that advice is priceless. It'll help you be able to start exercising in a way that's sustainable without having injuries. So I think that's where I would start.
That's a great point. I think starting off with a coach is really helpful. And I love the fact that you said just don't go with any Joe Schmo. I don't know who Joe Schmo is, but anyway. But actually looking at some of these schools for trainers where someone is maybe just starting off and trying to build their clientele, you may get something, a little bit more affordable, or someone who's able to give you like a short 6-week program to coach you to look at your form and make sure that you are doing it right. So I think that's a really great suggestion. Really, really great.
E-
Great.
Even free. When I was a
Even
kinesiology
free.
student,
Yes.
yeah. When I
Yeah.
was a kinesiology student, some of our projects were to design a personal training plan. So I
Yeah.
had a bunch of friends come up, and I was too maybe very eager, and I didn't think about like I gotta I gotta pay the
Yeah.
bills or whatever off. I'll give them free plans, and then I go like do the first session with them for free. But it was part of my training, so I could use it for credit for school. So you might even be able to get what you need for free
That
initially.
that is a really great suggestion. And another thing too is, we know there are a lot of great trainers online where you're watching them, but you don't have anyone watching you in terms of your form. You think you're doing it right, but a lot of the times when I work out with my coach, I'm doing the workout and he's like, okay, neck, back, posture, this, and I don't realize that my posture is off and that you can't see yourself. So actually having someone watch you and see what you're doing is really, really important. That's good. Tell me, what's your take on CrossFit? If someone is like, I'm just going to start CrossFitting, maybe they worked out a little bit. What's your opinion, or what's your perspective on CrossFit as an exercise, someone with experience in exercise physiology?
I love it. I think at the end of the day, people have to do what's authentic to them. If it's CrossFit, if it's Zumba or dancing, if it's just walking, I think you have to do something that's sustainable and something that's enjoyable to you. And CrossFit, I think it's gotten a bit of a rap as being a little bit cultish, depending on which CrossFit.
Well,
Um,
I hear I think the rap that I hear more often from my patients is like, I got hurt at CrossFit.
mm,
I got
yeah,
injured, maybe too
yeah.
much too soon.
So that's in that case, I'd say make sure that you have like a good foundation. Make sure that you've started off with like good aerobic training. Make sure that you're strong. Make sure you can do the exercises that they're asking you to do. If
Mhm.
you feel like something is a bit much, don't be afraid to kind of push back and say, hey, this is a bit much for me, and not get caught up in the hype of trying to keep up with other people. And
Mhm.
I think CrossFit too, they should have trainers there. So ask them questions. Ask them, am I doing this the right way? Can you watch me?
Yeah.
Or even tell them, is there another modification of this exercise? I think I'm not quite at that level. So I think we need to push ourselves, but within reason. We don't always need to push ourselves to see results with exercise. Take
Mhm.
walking. Walking seems like it doesn't seem like exercise. Even walking for like an hour does not seem like exercise, but it's one of the best forms of exercise. It's sustainable, it helps
Mhm.
prevent injuries, and it helps you get a great foundation for the rest of your training. So you can pull back or ask your coach, ask questions, or even if it's not working there, if the person's not paying attention to you, look for another place.
Mhm.
But go at a pace that is comfortable for you and is not pushing you too much. But if you enjoy it, more power to you.
That's great. When it comes to walking, couple questions. Are we talking about brisk walking? What are your thoughts on wearing the weights? I think they're called bear hugs or something. I see some people have stuff on their front back. I see some people having ankle weights as well. What are your thoughts? How helpful is that? Is it helpful or not?
I think it depends on your goals. If you are a beginner, your goal is just to start walking, start
Mhm.
moving. I think the best thing to do is just to keep things simple. Start off with trying to hit 40 minutes and then slowly increase your time. If you're able to walk 60 minutes, 90 minutes, and it's not a big deal, then you can start adding on the little extras. For example, if your goal is to try and burn fat, there is a target heart rate you can look at. So the target heart rate is 50 to 70% of your heart rate max. You can get one of those little Fitbit or trackers, and
Mhm.
then you want to walk for 60 minutes to 90 minutes. And as I mentioned, it's that 40-minute mark where we start to shift into fat burning zone. 60 to 90 minutes, you're really melting the fat. So if that's your goal, then you can do that. And then going to add on the things such as the backpacks, the ankle weights. People often do that if they're having difficulties hitting that 50 to 70% heart rate max because
Mhm.
they're in really good shape. So if you're in that situation where you've been walking for a long time, and even though you're walking briskly, you're only hitting like 40% of your heart rate max. And this is for many athletes. it's like they're not, their bodies are so conditioned that they have to push themselves very hard in order to get their heart rate to increase. If you're in that situation, go for it. But I think I'll do things in a safer way. Perhaps a safer way would be to get a backpack that is weighted, or one of those vests that is weighted. With ankle weights and wrist weights, there's a small risk of having an injury. For example, if you happen to trip over something, you're more likely to hurt yourself. So having something centrally, like in the middle of your body's more likely to distribute the weight evenly. So if you're in that situation, you can try the backpacks as well. But I think it depends on what your goal is. If your goal is just overall health, I would keep it simple. Maybe you can have a heart rate tracker and just keep track of where your heart rate is. But I think keeping things simple is probably the best thing to do.
Okay, I like that recommendation. Start slow, consistency, and then try and see if you can increase duration. Monitor your metrics, monitor what your goals are, and then when you get there, you can decide to add on something. And if you are going to start add on something like the backpack, because of that core balance. So that's really great. Good recommendations. So I'm not there yet. I don't need the backpack. I don't need the backpack quite yet. So a lot of people say, okay, doc, I want to reverse this insulin resistance. I don't want to have to take medication. I'm gonna push exercise. And the one thing they wonder is, how do I track my progress? How do I know how I'm doing? Because we know it's not just about the number on a scale. Trying to get away from just the number on a scale. So what measurements or what metrics that are easily and readily available for our patients to be able to track how they're doing? And not just patients, anyone who's even trying to track their exercise physiology progress.
I love that question. So I think if you're looking at somebody who's like in the general population, they have no other medical problems. Maybe their doctors told them, "Oh, you have a little bit of pre-diabetes, but we need to watch it. Your blood pressure is, pretty good." But you kind of notice, oh, I'm holding on to a little bit of extra weight. Like my pants are tighter than I'd like them to be. My clothes are a little bit tighter. I have this extra flab. Um, Start by saying, measuring your waist circumference. That's a good place to start. You can use a scale. You don't necessarily have to use a scale, but something that's, available for everyone, even if you don't want to buy a tape measure, is the way your clothes fit. The way you look in general. So you can start by taking a picture at the beginning of your journey and then tell yourself, I'm going to walk 4 days per week for, my 60 minutes. And then take pictures to track your progress, and maybe take them like 1 month apart. So you're going to pick, say, the first Saturday of the month, first thing in the morning before you've eaten anything and after you've gone to the bathroom. Take a picture front and back. And then the next month, do that. But give yourself time. So compare the pictures from month 1 to month 3. You're going to see, oh, okay, my stomach looks a little bit flatter. The flab in my arms is not the way it used to be. And then you can pick that outfit that your favorite outfit, and you might notice it's a little bit looser. So even within a few months, you're going to notice that you're losing fat, and it's going to be very subtle. But if you're patient, within 6 months, you're going to see a big difference in your body composition without necessarily making major changes to the rest of your life. So that's one scenario. If we have another scenario of an individual, say, who has diabetes, or they have high blood pressure, and they're going to start walking. They may want to do the pictures, but they have other data readily available to them. I have many patients who have high blood pressure, and they have their blood pressure machine, and they write their blood pressure down like every day. Some are very, like, they should have been physicians too. They write their blood pressure down 3 times per day. They're
anal. They're anal. That's what they are. They're just anal. They're just tracking that blood pressure, tracking everything.
Or see somebody who has diabetes and you're tracking your sugars. We've noticed with a lot of our patients who have high blood pressure, suddenly they'll be like, whoa, my blood pressure went down, or I'm feeling dizzy, and we have to lower their blood pressure medications. And if we look back, it's because they lost weight. So even if you're not conscious of losing weight and exercising, your blood pressure dose or the dose of your medications may go down. Your fasting sugars may suddenly start getting low. And if they do, please go talk to your doctor, because they do have to adjust your medications. But these are some of the markers that somebody has been losing weight. And it can be a concerning thing from one point of view. But if you're exercising, you are going to notice your sugars are a little bit lower. So these are markers you have readily available to you if you have diabetes or high blood pressure. I think that those are probably simple enough to start.
Simple enough. Glucose and blood pressure. How about the body composition scan? If someone says, I really want to know like my percentage fat, because sometimes people just like to have those numbers that are readily available. What do you recommend?
Yeah, as I mentioned, waist circumference is one that's easily available. These body composition scans, or so-called DEXA scans, to get the real body fat composition, if you want the gold standard, you're supposed to, I can't remember the exact, well, to describe it simply, you're supposed to go into a pool of water and stand on a scale. And that gives you your actual body fat composition. You can
Mhm.
also use calipers, but you'd have to have somebody that's a trained, say, body fat composition, an analyst or a kinesiologist. They can use the calipers and then use a formula to estimate your body fat composition. That's not perfect. And then we have these scales that estimate your body fat weight, but they're notoriously inaccurate. You can try and use them, but I wouldn't necessarily trust them.
Ah, I see. Okay. So you usually don't recommend that for your patients. You're better. You actually think waist circumference as a simple measurement is good enough, right?
Absolutely. And if you have access to the DEXA scan or to the method of weighing yourself underwater,
The
you'd have to
water.
find a lab to do that.
Okay.
Or somebody who measures your body fat percentage using calipers. That may be okay.
Okay. Okay. Okay. What can be tracked on a Fitbit or an Apple Watch?
Your heart rate. I think your heart rate, the duration of your workout. I think that's, or and the number of steps. The number of steps is
Yeah.
a, if you have, say, a target of 10,000 per day, probably by the end of the day, you'd still need to take a walk to make your 10,000 steps. But I think these are simple things that you can track and perhaps have targets to help you reach your goals.
Mm-hmm, mm-hmm, mm-hmm. And in someone, now we kind of talked about the healthy person who doesn't have a lot of issues, but if you see a large percentage of the geriatric population, right? People who are a little bit older, what recommendations would you have for someone who is older? Doesn't mean you can't exercise. My
Mhm.
dad is 80 and he probably works out more than me. But someone who may have some limited mobility, who may have some knee issues, back issues. Generally, I'll hear my patients say, My knee's out. I can't work out." There are many other things that can be done, especially because we've mentioned the different types of exercise and how energy is used in the body. So I'd love to hear your perspective on that.
I love that you're asking about our geriatric population because I think exercise is probably one of the best things that they can do in order to live long and to live well and to maintain their independence. As we get wiser, we tend to lose muscle mass, and there's actually like a medical term for this, sarcopenia, and we can actually bill for sarcopenia. It's like a
Mhm.
technical
It's a term.
diagnosis.
Yeah.
So as you get older, you want to try not only maintain muscle, but you can build muscle. So if you're 65 years and older, it's never too late. But again, I'll tell you to start simple
Hmm.
and get somebody's help. So, for example, if you are wheelchair bound, you can do something as simple as getting one of those, I think they're called hand bikes. You can get a hand bike, and when you're watching TV, use your hand bike. Time yourself and say, "Okay, I'm going to watch a show for 1 hour, and I'm going to use my hand bike."
Hmm.
If you have the means and the resources, a lot of universities have exercise programs for people that are a little bit wiser and older. And in that case, you'd get somebody who's trained. They can monitor your heart rate, they can monitor your blood pressure, and make sure you're doing exercises properly and in a way that is customized and takes into account your physical limitations. Another thing to try, say if you don't have access to a university or customized exercise programs, if there's a pool nearby, you can see if they have aquasize. A lot of pools have these exercise classes. They're going on in the middle of the day when the kids are not around, so you can enjoy your pool and your exercise in a nice, quiet environment. And if you are an adult or an older adult who is, fairly fit, you've been able to walk, you're fairly mobile, you can look into different online programs to start calisthenics. You don't necessarily have to travel far away, but you can look online and see if you can, participate in different exercise programs. They don't have to be complicated, but I think it's extremely important as we get wiser to try and ensure we're doing something to build our muscles and to maintain our muscles. But so just in summary, aqua size is one example. The hand bike is another example. I think there's also these stationary, bikes. Like you can sit down and you can get like foot pedometers. And I have a story about that. I had a patient who had arthritis and she had a lot of difficulties walking. And I told her to get one of these little stationary, pedaling things from Amazon. Her knee pain went away. I was shocked. After months, like a few months, she came back and she was not hobbling. And I was like, "What happened to you?" She's like, "Exercise." So it's so powerful.
Exercise and movement can really reverse and help overall.
Absolutely, absolutely. For people who are thinking about surgery, there's a lot of patients who, if you start exercising, your knee muscles get stronger and you lose a little bit of weight. You might not need to undergo surgery after all.
Yeah. Or your recovery may be easier and smoother, right?
Oh, 100%, 100%. There's a movement now for people who are preparing for surgery called pre-hab. So pre-rehab. If you are stronger before you go into the surgery, you'll leave the hospital faster and your recovery will be better. And then you have post-surgery rehab as well.
Oh, wow. Fantastic. Okay. Well, let's talk about some of these apps, resources, how people can get started, how they can be accountable to themselves, maybe even share their updates with their providers, their physicians, or their coaches. Tell us more. I know you've got a lot to share there.
Okay, so depending on how tech savvy you are, if you're tech savvy, if you have your iPhone, you can do something as simple as going in the notes section and tracking your workouts. Track how long you work out, and you can share that, with either your doctor or your personal trainer, or even as a personal thing. You can have personal goals to say, okay, if I hit my 4 workouts per day for the next month, I can buy myself XYZ treat, maybe a non-food treat. Maybe if there's an outfit you want to buy, you can use that to keep track and to help yourself improve. Fitbits, for those of you who have Fitbits as well, you can track your heart rate. I don't have a Fitbit, so guys, forgive me if I'm telling you things that are not quite there. But from what I know, you can track your heart rate, and I suspect you can track the number of sessions you have. There are also devices you can get online that are heart rate monitors, and there's an app. I'm trying to look up the one that I have. I have a nutrition coach that actually recommended one for me. It kind of escapes me right now, but I think if you do get heart rate monitors online, you can actually put the app, like download the app in your phone, track the workouts, and share it with your personal trainer as well. So my nutrition coach was actually using this to track my sessions, because I'd say, okay, I've worked out this many times. He can log in and see, and then he'd be like, well, you're walking too slow. Increase your heart rate. So you can share that with your trainer and say, hey, this is my heart rate. Did I actually make the metrics that we need to make? And that can help them help you make adjustments. I think some of these apps as well, from what I remember, Nike as well, not only has a heart rate monitor, it also has different exercise sessions that you can download and work out along with in order to meet your goals. And then in terms of my favorite online resources, there's a lady on YouTube. Her name is Carolyn Gervin. She has free workouts, and her workouts, to be honest, are quite intense. I wouldn't necessarily recommend this for a beginner. But during the pandemic, she started sharing her personal, exercise sessions with people, and she's a personal trainer. So I think for 2 or 3 years, she shared all her sessions, like 1 hour, 2 hour long sessions, 5 days per week for free. And when I was consistent with that, I noticed a big improvement in my health and in my strength. So you can check her out if you're somebody who's hardcore workout person and you don't want to go anywhere. You will get an incredible workout with her workouts. And
how do you spell her last name, Doc? How do you Caroline Gervin?
Caroline, Girvan.
Oh, good. Okay. All right. We'll definitely post that in the comments.
She actually has sessions, like she'll have or programs, like a 3-month program every day. Like she was posting workouts, so you can go back and watch the replays.
And it's all free.
For free. Yes, for free. But again, as I mentioned, I really think her sessions are quite advanced. I think for the first 3 months I'll soar every day. If you're brave. After you work with your trainer and you have technique, go ahead and try some of her sessions.
Yeah, well, yeah, I will try, and I'm sure there are people in this group who are probably a little bit more advanced that would like to know. But there are many options online right now on YouTube. There's some great ones, but good recommendations go a long, long way. So this is really great. This has been an amazing conversation. Amazing conversation. There's a lot of personalization when it comes to exercise, right? For each person, consistency is key, right? And then I think the last thing I heard from you was also kind of being able to have someone who keeps watching your form so you don't hurt yourself and keeps pushing you so that you actually optimize what you're doing in terms of, really using your storage and turning fat into muscle and really burning the energy so that you can reverse that insulin so that you can see the results on your heart rate, your blood pressure, your glucose levels, and actually see objective data. So that's really, really amazing.
Absolutely, absolutely. And I think there's so many things I still wanted to talk about. Maybe we can, I'm going to invite myself back to your show another
I
time.
think you have to invite yourself back because I just had another question pop up about um, supplements, pre-workout supplements, creatine, micronutrient supplements that people take. I think we have to do a part two in terms of what's the data behind this really, and
Ah,
especially when you compare it to just wholesome nutrition.
yeah.
Because I have a lot of patients coming in and they go to the gym like 3 times a week and they have like all these pre-workout whey supplements, and I'm like, what is you are not going for the Olympics. What is all of this for? So we have to absolutely do a part two. So this is our part one, Doc.
Yes, I love it. I love it. And yeah, the supplement world, it's a landmine, not only for, if you're educated as a physician, there's some things you can kind of read and be like, I don't know about that. You can like go to Up to Date and read up on stuff. And there's stuff that works. But I think for the general public, that is a big landmine. And I think that's going to be a great conversation.
I think that's going to be an amazing conversation, educating people, making sure they're not wasting their money, and focusing on what's really. I think when you go back to the basics, that's where you get a lot more bang for your buck. Just sticking to the basics, right?
100%. And and I'll share some tips. You don't necessarily need to buy the expensive stuff. There's some ways you can make your workout more effective with stuff you
Yeah.
have in your own kitchen. So we'll talk.
Oh, I'm excited. I'm excited. I'm excited to talk about that.
When I
Thank
tell you the secret, you'll be like, "What? That's it?"
I'll be
But
like, really? Dr. Anita, thank you so much. This was a wealth of information. This was a great conversation for someone who's just ready to take action. I know a lot of people in the beginning of the year have resolutions, New Year resolutions, and they really want to know, how do I get started? So, beyond just going to your doctor and your doctor saying, just exercise, I hope that Dr. Anita and I have been able to share some tips about how to start, the different types of exercise, the intensity, how to push yourself, and getting a coach. A trainer would be helpful in different ways. You can access someone affordable and reliable online, or a coach that you want to start working for, someone maybe from a school that's just starting their business. Very, very helpful tips. The YMCA has a lot of activities for our older patients as well. So a great resource. I know a lot of my patients are part of the Silver Sneakers Club and do a lot of aqua aerobics with them as well, which is great. Thank you so much, Doc. One more word of wisdom. How do you stay so fit? You look great.
oh, wow, 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 wow. How do I stay fit?
You
I
have
think
a coach and you
no.
work
My nutrition coach, yes, but the
out.
thing
Okay.
is, he was such an incredible coach that he empowered me. He's like, I
Mm,
want you to have this knowledge for life. So I think eating whole foods is the most important thing. Focus on your veggies, focus on your protein. I think I worked with him formally 2 years ago, and I still keep in touch, and I've maintained the weight. So if you get somebody who teaches you and empowers you,
mhm.
you're good to go.
That is so wonderful. Amazing. Thank you so much, Dr. Anita, for coming on.
Thank
And we
you.
look forward to part two.
Yes, I'm looking forward to it. Thanks
All
again.
right. Bye bye.